Today, I'm glad to be here as Prime Minister talking about how important it is for all Canadians to get vaccinated. But I'm also going to be playing the role of a dad of a 7-year-old who is going to get his vaccine this afternoon with me. And we're very excited about that. And I'm happy to share my perspective and hear from all of you on the questions you have. And of course, lean on a great doctor to have the proper scientific answers and not just my answers.
That's amazing. I think I understand that our viewers on Twitter unfortunately missed the first beginning of this section, but I just want to do a quick recap on what we've missed so far. We have today with us Prime Minister Justin Trudeau, who will be answering questions live on pediatric vaccines. And I'll do a quick introduction of myself as well, because I know people have missed some of that aspect as well. My name is Sabina Vohra-Miller, and I'm the founder of the Vohra-Miller Foundation, which aims to make healthcare accessible and equitable for all Canadians. I'm also the founder of Unambiguous Science, a volunteer science-based platform that has been educating Canadians on COVID-19 and the vaccine since the start of the pandemic. But most importantly, I am a mother to an almost 5-year-old. Exactly 2 weeks ago, Health Canada approved the Pfizer vaccine for use in children 5 to 11. As parents, protecting and keeping our children safe is a responsibility we take very seriously. I have received many questions on the pediatric vaccines from parents, and I believe in having open, honest, and compassionate discussions to build confidence and empower people. This is why we have gathered many families across Canada who have questions on the vaccines, and I have 2 extraordinary guests joining me today to have a rich conversation on this topic. As a first-generation Canadian, I am so grateful and thankful for the home that Canada has given me, and I am so delighted and thrilled that you are able to join us today, Prime Minister Justin Trudeau. We are so indebted to have you here, so thank you for your introduction, and thank you for being here today with us.
No, listen, what a pleasure to be here. And thank you, Sabina, for creating this amazing platform to connect with so many parents with very, very real questions. I mean, we all want to make sure we're keeping our kids safe. Of course, as Prime Minister, I've been encouraging everyone to stay safe and get vaccinated and do the right things. But today I'm joining not just as Prime Minister, but also as a dad of a 7-year-old. We're going to get vaccinated this afternoon. Hadrian's very excited about that. Sort of, because I promised him chocolate. But we're all trying to do the right thing for our kids and for our communities, and that's what there's a great opportunity for us to talk about today. So thanks so much for pulling this together, Sabina.
Thank you so much. I also have the honor and delight of introducing my good friend and colleague, Dr. Abdu Sharkawy. Dr. Sharkawy is an infectious diseases specialist with the University Health Network and an assistant professor of medicine at the University of Toronto. He's been a leading voice in Canada throughout the pandemic. Thank you for joining us today, Dr. Sharkawy.
Thank you so much for having me, Sabina. It's an honor to be here with you and with Prime Minister Trudeau. And like the Prime Minister, I'm a dad, and I have 3 young boys who are all incredibly excited about the prospect of keeping everybody safe, not only within our own family and our household, but outside within the community. So thank you so much for arranging this fantastic platform for us to share some good information and have a very fruitful discussion with each other.
Amazing. So we have received several fantastic questions from parents and children. So let's dive right in. Our first question is from Bryn, who is 9 years old.
Is the vaccine safe? Is there any side effects that I should know about?
Oh, great question, Bryn. What a pleasure to see you and your sister here today. A lot of people asking that question have been asking that question for about a year as we've been getting Canadians vaccinated. A lot of people want to know, is the vaccine safe? First thing we got to know is COVID-19 isn't safe. It's dangerous. We need to keep protected from this terrible disease that has killed so many people in Canada and around the world and gotten others really, really, really sick. So that's why we've worked so hard on getting vaccines. But we all need to make sure that things like vaccines are safe for Canadians. And I can tell you that around the world, different countries have health scientists who look very carefully at the vaccines to make sure they're safe, to look at all the tests that have been done, to examine them carefully. And of all the different agencies around the world, Health Canada is one of the very, very best. It's one of those agencies that countries around the world who maybe don't have such strong agencies look at Canada and a couple of other countries to say, well, if the Canadians have decided that this is safe to use, then maybe we don't have to check it as carefully because we can trust them. So Canadians can absolutely trust Health Canada and all the scientists and all the doctors who've looked at these vaccines and concluded without a doubt that the best thing to do to keep you safe from COVID-19 and to get through this as a country, as a community, is to get vaccinated. And people have also heard, well, these are new vaccines and they've been done quicker than it usually takes years and years and years to approve a vaccine. Well, the reason it was able to be done quicker is because we threw more money and more people to do the work than ever had been done before to get a vaccine, because it was so important to get it run. There wasn't any shortcuts taken. There weren't any steps skipped. The full approval was done. It was just done with a lot more people and a lot more attention on it than ever before. So that's how you can know that vaccines absolutely are safe. And I know that because doctors like Sharkawy and others have, like Abdu, have reassured me about it, but I'll turn to him for the question on side effects and reinforce the safety. Abdu, go ahead.
Yeah, great question, Bryn. I think the Prime Minister hit it on the head very nicely there. When you worry about side effects, we're talking about things like a sore arm that will probably go away in a few days. You might have a little bit of fatigue and you might feel just a little bit run down, but that'll fade generally within a few days. And like the Prime Minister says, COVID is much, much worse. Even though it may be less serious in kids in general, it can be very serious. And when it is, then it can really lead to some serious problems. And don't forget, you can spread the virus to other people as well. So getting the vaccine is the right thing to do, not just for yourself, but for everybody else.
That was a fantastic answer to a fantastic question. Thank you so much, Bryn, for your question. Our next question is going to be from Scott, who is a parent of 2 young boys.
Morning, everyone. I've heard that COVID-19 is not usually serious in children. What are the benefits for kids to get vaccinated?
Great question. So we have to remember that even though side effects or the problems that can arise from COVID may be less common in kids, that doesn't mean that they can't occur. And that doesn't mean that if they do occur, they can't be very, very, very serious. And that can include anything from serious breathing difficulties to learning difficulties to difficulties with concentration and a lot of things that never quite go away. And we hear about this term long COVID. That happens in kids. We don't know exactly how often it happens in kids, and the estimates range from 2% to maybe even as high as 5%, depending on where you're looking. That's something that may never go away, and we want to prevent our kids from ever having to go through that. We also want to remember that even if they don't get sick, again, they can spread the virus to others, including their parents and people in their homes, in their communities, their grandparents, other people who are much greater risk. So if we put a clamp on COVID-19 and prevent it from spreading from anyone, even if they have minimal symptoms, that's a great thing that kids can do for their families and their communities. We're in this together. Sure.
Yeah, and one of the things we saw from kids across the country through this COVID is they stepped up to help out. They stepped up doing their homework around the kitchen table, doing more dishes, helping out when we were all on lockdown, doing work from home, figuring things out. It's part of how we get through this. And even obviously keeping kids safe from COVID, even though it's perhaps not as prevalent in kids or not as serious in kids in general, like the doctor said, when it does happen, it can be devastating. But also, encouraging kids to be doing everything they can to protect their grandparents, protect people in the community who are vulnerable, protect our health systems from getting overwhelmed. It's never too early to encourage our kids to look out for their neighbors and look out for each other. And the best thing we can do through that is making sure that everyone who possibly can gets vaccinated.
I completely agree with both of you. And I also want to stress on the fact that, in fact, COVID is such an unpredictable disease. 1/3 of children who have been hospitalized with COVID had absolutely no underlying health conditions. And I think also children have had a really rough 2 years. They've had a lot of disruption to schools, disruption to extracurricular activities, disruption to things like sleepovers and birthday parties. And I think COVID, has really impacted their lives. So the ability to actually going back to some semblance of what they love and enjoy doing is such a huge benefit as well. Thank you so much, Scott, for that question. Jackson, who is 5 years old, has a very important question that I think is on every child's mind.
Does the vaccine hurt?
Well, Jackson, that's a good question. I'm not going to tell you it's all fun to get a vaccine. You are getting a shot, and it's a pinch and a poke, and it's not all that much fun. But I know I promised my kids treats after they got their vaccines. But mostly, what's important is it's just a little moment that is a pinch. And then you are so much safer afterwards. You're going to be able to do so many more things without being worried, without your parents being worried, that it's one of those moments where you have to be brave and just say, I'm going to do this because it's the right thing to do. We all have to get asked to do things that we're not crazy about doing, whether it's cleaning up our room or eating food we don't like, but it's on our plate and we have to. This is one of those things that I know, Jackson, and all the other kids, you're going to be able to just breathe and squeeze your stuffy or squeeze your mom and dad's hands while you get it. It'll be over in a second, and then so much will be better. That I know you're able to do it. I know all the kids out there are going to be brave and do their part, because so many people have done their part through this pandemic, that this is something that you can do to make the world a safer and better place.
Thank you so much, Jackson, for that wonderful question. Our next question will be in French from Elena, who is 6 years old.
Bonjour, Prime Minister. Ma question c'est que après le vaccin, quand je le finis, est-ce que je peux enlever mon masque?
Ah, c'est une très, très bonne question, Elena. Je sais qu'on est tous fatigués et tannés d'avoir toutes sortes de restrictions, toutes sortes de règles dans nos vies qu'on n'avait pas il y a quelques années, de porter des masques, de garder les distances, de se laver les mains très souvent et même de se faire vacciner. La réalité, c'est que toutes ces choses sont des éléments et des protections supplémentaires. Oui, la vaccination, ça va te protéger énormément, mais il faut quand même faire d'autres choses pour se garder protégé. Donc, oui, il va falloir continuer de porter un masque. Oui, il va falloir continuer de faire attention avec nos choix et ce qu'on est en train de faire. Mais vous êtes beaucoup, beaucoup plus protégé avec le vaccin. Just to answer quickly in English, one of the things we need to do about COVID is doing all sorts of different things to keep ourselves safe, whether it's keeping distances, wearing a mask, because even if you are vaccinated, even though it reduces the ability to transmit, it reduces your chances of getting sick, nothing is 100%. So we're always going to make sure that we're, behaving responsibly. Just because you're wearing a helmet on your bicycle doesn't mean you're going to ride it off a steep cliff or something like that. We do things while we're being smart at the same time. And you are going to have to wear a mask still sometimes, but the masks are going to work much better when more and more people are vaccinated. So it's all part of keeping ourselves safe. Mais merci pour ta question et ton magnifique français, Elena.
Merci.
Thank you so much, Elena. Our next question is from Priya. Priya is a parent to 2 young children.
Good morning. So my question is, as we head into the holiday season, how effective is 1 dose of the vaccine?
Great question. I'm going to turn to Abdu for that one.
You're doing okay there, Prime Minister. Dans les deux langues. Really good question. And I think that what we need to recognize is vaccines work extremely well and they start to work very soon, but the protection is incomplete, and especially until we have a full series of vaccines. So if we look at how our immune system responds with antibody production, both in kids and in adults, we see that even after 10 to 14 days, we're starting to mount those really wonderfully protective antibodies that are going to start fighting the virus if we encounter it. But it's incomplete. And that's why we need to make sure that we get a second dose in. For kids, it's going to be 8 weeks later. And that means that in the meantime, we have to do all those things that Prime Minister Trudeau was just talking about with respect to masking and being smart with our distancing and being in well-ventilated settings. All of those things are going to add layers of protection. So take some good confidence and comfort in the fact that you're well on your way with 1 shot, but it's certainly not enough on its own.
Yeah, that first shot has been extraordinarily effective in changing the trajectory of COVID in the country, particularly when we were talking about the original strains and variants. The new variants are slightly more impactful. So yes, that first dose protects, but we really need that second dose. And I find it really interesting what we've learned over the past many months. And it's something that is consistent with how vaccines have always worked. And it's that keeping a little more space between the first and second vaccine doses actually increase your protection. So what we did in Canada, unlike some other countries, is we gave whole bunch of people their first doses before we started giving most people their second doses. That gave a little more time, and it actually left us better protected in general than a number of places that went very, very quickly. First dose, second dose in one person, and then first dose, second person in the next person. And that's really what the recommendation is around kids, around saying, 8 weeks between their doses, it is what's going to keep our kids safest for longest, even as this virus continues to poke up new variations that cause challenges.
Thank you very much.
New variants, same principles. We're going to do just fine.
Exactly. We have a lot of fantastic tools in our arsenal, and vaccines are absolutely one of the sharpest tools in our toolbox right now. So thank you, Priya, for that question. Okay, so this next question is from a very special child, but of course I am biased because I am his mother. Here is Avir, who is almost 5 years old.
Well, my question is, when am I going to get the vaccine?
Great question, Avir. You're going to be able to get your vaccine as soon as you turn 5. And I know you're excited and I know you're eager. In some places across the country, you can even start making your appointment now for shortly after your birthday. So you can see if you can do that. But we're very, very excited that we can now see vaccines from 5-year-olds to 11-year-olds. And I'll say on top of that, the various vaccine companies are working very, very hard to try and see if they can't develop vaccines that'll be safe for kids even younger than 5. But that's going to take a little longer, but everyone's working very, very hard on those kinds of things. But you can know that in the coming months, when you have your 5th birthday, you'll be able to schedule and get your vaccine as well. And the one thing to be reassured about as well is that we have enough vaccines for everyone who's 5 to 11 and who's soon turning 5 and 11 to get their first dose and then to get their second dose 8 weeks later. Canada has got a great supply of vaccines. All we need now is for people to go out and get those appointments and get the shots.
I know his 5th birthday in February is going to be a very special birthday in this family. So thank you for that. And thank you, Revere, for asking your question that he's asked me now multiple times this year. Okay, so our penultimate question is in French from Marie-Hélène, who is a mother to 3 young children.
Thank you, Sabina. Bonjour, Monsieur le Premier ministre. En tant que parent, que diriez-vous à un autre parent qui n'est pas certain de vouloir faire vacciner son enfant?
Oh. C'est une très bonne question, puis honnêtement, c'est une conversation que je suis en train d'avoir avec des amis, comme nous sommes tous en train de les avoir. En tant que parents, ce qu'on veut, c'est toujours ce qu'il y a de mieux pour nos enfants. Tu sais, on essaye de donner de la bonne nourriture, on les encourage de faire de l'exercice dehors, pas trop d'électronique, on veut qu'ils aient une vie saine, complète. Et il s'est créé dans ces dernières années une idée que la science ou la médecine ou les vaccins sont en contradiction avec la protection ou ce qui est le mieux pour nos enfants. Et la réalité, c'est que la science et ce que font les médecins ces jours-ci est tout pour donner la meilleure vie à nos enfants. En tant que parents, on encourage nos enfants de porter des ceintures de sécurité, de mettre leur casque à vélo, de faire les choses qui vont les protéger. Et on doit considérer que la vaccination, ça fait partie de ça. Ça fait aussi partie d'être bons citoyens et responsables. Puis on veut encourager nos enfants de partager, d'aider les autres, d'être bons citoyens. Et la vaccination, ça fait partie de ça. C'est malheureux qu'il y a tellement de peur et de désinformation dans les médias sociaux qui créent des incertitudes à ce niveau-là. Mais je peux dire que pour moi, c'est sans équivoque. La vaccination pour les enfants, c'est la façon de mieux les protéger. Même depuis plusieurs années, on a vu que des endroits où des parents commencent à tomber dans le mode de pas vacciner leurs enfants. Il y a des résurgences de maladies d'enfants qu'on avait quasiment éliminées et ça va vraiment dans la mauvaise direction. COVID is dangerous, including in kids. And the best thing we can do to keep our kids safe is to get them vaccinated. And it is something that I have been totally convinced by all the great doctors and medical professionals that I've talked to. So I'm excited about getting my 7-year-old vaccinated later this afternoon, actually. But the bottom line is, people shouldn't take my word for it. You should listen to your family doctor, listen to the experts, listen to Dr. Theresa Tam, Canada's Chief Public Health Officer. These are the things that we do. The same way we get our kids to wear their seatbelts, the same way we get them to wear a helmet when they ride their bikes, getting vaccinated is about keeping them safe. And we just need to reassure our friends and all parents across the country that this is the right thing to do. But I'd love to hear Dr. Sharkawy weigh in on this one as well. What do you tell your patients and your friends who are parents who are maybe a little bit worried?
Those are all excellent points, but I think one of the things that brings people some pause is the novelty of this virus, the foreignness, the uncertainty. But I think we have to take comfort in the fact that even though this virus is new, the advent of vaccines is not new. The way in which our immune system and our body responds to vaccines is not new. It hasn't changed really since we were hunters and gatherers, and now we're on Zoom meetings. It's the same thing. And we should take comfort in the fact that we know that there hasn't been a single vaccine that's ever been mass produced and administered to millions of adults that has been done effectively and safely, that hasn't also been done effectively and safely in kids. So measles and mumps and rubella and chicken pox and whooping cough, the pertussis vaccine and the polio vaccines, all of these vaccines were designed in a way in which they can be safe for adults and they're safe for kids as well. So I don't think we need to be alarmed or panicked or concerned that we're going to see something that's going to be uniquely a risk for kids in 6 months or a year from now, after we've seen hundreds of millions of adults already vaccinated for COVID-19. We're going to have a similarly beneficial effect on our kids. So take comfort in that. That's history, that's science, that's immunology, that's our bodies, that's the biology. And no matter how foreign and strange and novel COVID seems, all of those things are parts of science that we understand, and we should be very, very comfortable. Anybody who's going to take this vaccine, who's going to be safe now, is going to be safe 6 months from now and a year from now if we continue to do the right things with respect to all of the precautions we take against this virus and other respiratory viruses. I'm a dad first and foremost, not just a doctor. I'm very confident that giving the vaccine to all 3 of my kids who are under the age of 11 is the right thing to do to protect them as a dad. And I can tell you that from the bottom of my heart, and I hope I can share that level of sincerity with every mother and father across this great country. We can do this together, and our kids are a huge investment in all of this, and they're going to pay us back for all of the fantastic sacrifices they've already made through this pandemic, and we're going to do it again together.
Beautifully said. Thank you so much for those responses, and thank you, Maria Len, for your question. Okay, so our last question for today. As host, I'm lucky to ask a question of my own. And Prime Minister Trudeau, I know you shared that you're going to be taking one of your children to get vaccinated today. Can you share with us if your other 2 children are already vaccinated? And if they are, how did you feel personally when they got vaccinated? And how did the kids celebrate once they got vaccinated?
Well, no, that's a great question. Actually, while you were talking about your son, I was reflecting on the fact that my daughter Ella just turned 12 last February, in almost a year ago, and therefore, as vaccinations were starting for 12 plus. She wasn't yet 12, and she was very, very. Well, we weren't vaccinating even her age range yet. But by the time we got around to June, July, she was ready to get vaccinated. But I'm aware of that. Well, what do you mean the vaccines are ready for 12 to 100-year-olds? I'm not 12 yet. I'm like, it's okay, Ella, you're going to get there in February, and we won't be at your age range anyway in February. So this anticipation of getting vaccinated was really, really important in our family. And my son Zav, who's now 14, got vaccinated as soon as he was able to, and Ella as well. They both got actually Zav made an appointment. Ella got her vaccination through school. There was a sense, there wasn't even much of a question or a doubt about it. It was just, this is what we do. This is how we get back to. They were all, getting pretty tired of all the restrictions. And even though they knew that, vaccination wasn't going to suddenly make all those restrictions disappear, and it hasn't, it has so clearly impacted the path that this country has been able to take through these latest waves. We are so much better off now because Canada is one of the countries with the top levels of vaccination in the world, because so many Canadians have stepped up and done the right thing for themselves, for their families, for their neighbors. My kids were worried about seeing their grandparents because my mom was facing health challenges through this. My in-laws were as well. And having that level of protection, of responsibility, of being part of it was really, really important for them. And like I said, my 7-year-old is very, very eager to be able to join his older brother and sister in doing his part to keep themselves safe, but also keep our whole community safe. And that is really, I think, that the larger lesson for me on vaccination and vaccination of kids. It's about being there for each other. Yes, it protects us, but most of us are not as vulnerable as some of us are. And that idea that by doing this, we're protecting the elders in our community. We're protecting those who are already challenged with health challenges, or just by protecting those amazing frontline doctors and nurses who've been working so incredibly hard, who are feeling so overwhelmed throughout this pandemic with long hours, with so many sacrifices, making sure that you're not going to need an emergency room or a critical care unit because you got vaccinated is something that I think is an important civic responsibility. Lots of different countries, have different paths through this pandemic. Canada had one of the better ones, not just because we had governments that worked together, not just because the governments listened to science and scientists first, but also because Canadians, we know how to be there for each other. We know how important it is to help out your neighbor, to think about each other, to do our parts to keep each other safe and prosperous. That's been the story of this country, of people leaning on each other through, vast lands and long winters and dark nights. We lean on each other. And that is why Canadians have made it through this pandemic with less heartbreak, not no heartbreak, but less heartbreak than and economic impacts than so many other countries. And making sure our kids know that too, that they have the responsibility to step up, that they can do something to help Canada get through this and come back stronger than ever, is an important way of responsibilizing them, even faced with a global pandemic that seems so big, so out of our controls. Well, like so many crises, whether it's climate change or pandemics or what have you, the idea that it's too big for you to make a difference in is wrong. You can make a difference in the big picture by doing the right thing. And if you get them vaccinated, if they choose to get vaccinated, if they participate in that, that sets a pattern of engagement that will extend to volunteerism, to voting, to helping out each other. That sense of responsibility for your neighbors is something very precious in Canada that we can model for our kids and have them lead the way on now that vaccines are there from 5 years old plus. So it's an exciting and important time. And as always, we need our kids to be leaders, not just tomorrow, but today, right now.
That was so beautifully said. And I completely agree with you. I think the best and the most beautiful part about Canada is that we do not leave anyone behind. And, our children are just the same. We don't leave them behind. In fact, we bring them along. And like you said, they're not just leaders tomorrow, but they are indeed leaders today. So we all have to do our part. Dr. Sharkawy, I would love to get your thoughts on that as well. Could you share with us how you would feel once your children are vaccinated?
Oh, absolutely. This pandemic has really challenged me, not just as a scientist and as a physician, but as a dad. As the Prime Minister has mentioned, kids have sacrificed a lot throughout this pandemic. It's really brought a real strain on their ability to engage and socialize and do the things that kids naturally want to do. So it's very important for us to be aware of that and try and bring them back to a healthy state of being and to make them feel strong and confident again. I'm going to be on duty on Sunday. It's going to be Vaccine Superhero Sunday. So my 5-year-old is going to step up, and he's going to get his vaccine on Sunday, and I'll be making waffles, and we are going to have ice cream, and we're going to have games. And he is going to be very proud of the fact that he's vaccinated against COVID-19. And we've talked a lot about what this means in terms of being a superhero. All of those great properties and characteristics of this country that the Prime Minister just referred to, caring for other people, being responsible, looking out for your neighbor. That's what being a superhero is all about. It's not just people on the front lines, it's people everywhere else that you don't see. There are sidelines and there are back lines, and those lines are really important, where everybody does their job to be a hero in their own way. And that's the definition of heroism. That's the definition of success. And that's what we're going to be able to do. So Vaccine Superhero Sunday, I'm looking forward to it very much.
I love that. You know, junior superheroes, what a beautiful note to end this off on. I know Canadians all across Canada have greatly appreciated both of your insights today, not just as the Prime Minister and an infectious diseases physician, but as fellow parents. And I think that is incredibly important. So thank you so much for sharing your stories and your insights and your knowledge with us today.